hand over to Michael Preston.
Thank you, Sharon, and good afternoon, everybody. It's really nice to see some familiar faces from work that I've previously done in Sussex, particularly for East Sussex, a couple of SARs that David and colleagues have overseen and managed. So it's good to be back, albeit virtually. So let me share my screen and then I'll set the scene for what I'm going to try and do. So here we go. So I have sent Sharon a copy of the slides. I've also sent a handout version of the slides. I hope that all of you will have received or will receive certainly the handout version of the slides. I've no objection to you disseminating the handout version, and equally if you want the slide deck itself, Sharon and Abby have the slide deck, and I'm more than happy again for you to use any part of the slide deck if you think that that is useful. And for students, social workers in the virtual room this afternoon, great that you have joined at the beginning of your social work career, and hopefully you'll find the presentation useful for any assessments that you have to complete, either practice assessments or academic assessments before you qualify. I should also thank, in her absence, Christine Cocker, who is a professor of social work at the University of East Anglia. She is responsible for the Magdalen Safeguarding Adult Review that I will talk about a little way into the slides, and she contributed the couple of slides in relation to that particular case. So thanks to Christine, who's done a lot of work on transitional safeguarding, along with colleagues in research in practice, you might want to refer to her work, and there are some references at the end of the slide presentation. So let me set the scene. I qualified as a social worker in 1978. At that time, there were a number of concerns being expressed by social workers through the British Association of Social Workers and other bodies. And one of those concerns was about the poverty of provision for care experienced young people as they approach transition. And an academic researcher and professor of social work, Mike Steen, was very much at the forefront of that particular concern, that we were failing too many care experienced young people as they approached and navigated through transition. So if you, like myself, are concerned about transitional safeguarding for care experienced young people in 2023, our concerns are not new. And I've given you two references to Mike Steen's work at the turn of the century. I've given here on this particular slide just two of the sadly quite numerous investigations and judgments by the local government and social care ombudsman, highlighting the evidence about how the state is failing care experienced young people, and in many respects continues to fail care experienced young people. So the concerns are not new. I may, from time to time this afternoon, come across as sad at the continual witnessing of cases where the state has not supported care experienced young people adequately enough as they navigate through transition. And I might, at some stages of the presentation, come over as outraged by the state's continual failure to safeguard young people and young adults who are care experienced. Perhaps it is a feature of now being 71 years of age that I feel I have permission at times to be outraged or indeed outrageous. And I hope for those of you who are at the beginning of your social work careers that you will continue to be passionate and committed about human rights and about social justice for people who experience discrimination and multiple oppressions and injustice. And transitional safeguarding is one of those areas, I think, where we need to remind people that our concerns have a long history, as indeed this slide identifies. And part of the evidence for the poverty of provision for care experienced young people and for care experienced young adults comes from academic research and indeed from the contributions of practitioners and operational managers and indeed from the voices of people with lived experience. And this slide presents just a snapshot of what we already know and what we continue to know. And maybe this is one point where I might feel certainly sad and probably outraged that if we know this already, why are we not doing anything about it at a state level? Why are we not providing a legal policy and financial context within which care experienced young people and care experienced young adults can thrive? We know, for example, about the risks of homelessness immediately after young people leave care. We know that a considerable percentage of adults who experience homelessness or insecure forms and temporary forms of accommodation have at some point been looked after by local authorities. We know that many of those young people and young adults do not have family and friends to turn to, do not have stable social networks. We know that children's social care workers are very often the most stable individuals in the lives of care experienced young people, and yet that continuity and that support can disappear sometime around the age of 18. And we know that certain social groups are overrepresented amongst care experienced young people and indeed amongst the population of young adults experiencing homelessness. And we also know about the impact on practitioners and operational managers in adult social care, in adult mental health, in children's mental health and children's social care of large caseloads and indeed the challenges of recruitment and retention. We know, for example, that the average life of a social work practitioner is 8 years. Compute that in relation to the needs for relationship-based practice, for continuity and for trust of practitioners by care experienced young people. We know this already. We continue to know this. This is not new knowledge. And coming more or less right up to date, and of course Ofsted is sadly in the news this week because of the death by suicide of a head teacher. But Ofsted last year published a review of care leavers' experiences of transition. And reading this reminded me of Mike Steen's work, going all the way back to the 1980s, and particularly the work that he did in the run-up to the Children Leaving Care Act 2000. There are synergies between what is reported by care experienced young people in the Ofsted report, synergies between that and the findings in Mike Steen's earlier research. And when you look at this, take a temperature check or an appreciative inquiry about your lived experience of working with care experienced young people and care experienced young adults. And if you're not working directly with them, you may be able to take a temperature check or an appreciative inquiry about what you know practitioners are saying to you and to others about the challenges of supporting people as they navigate this particular transition. So many feeling that they leave care too early and often abruptly. Many feel that they have not been prepared with the knowledge and the skills to live independently. Many feel alone or isolated, and many, sadly, do not have trust or confidence in the different practitioners, the different professionals that might be seeking to support them. And for those of us who are parents or step parents or foster carers who are in the room today, we will have personal experience of the support that we provide, the love that we provide, the safety net that we provide for children in our lives, and indeed for adult children in our lives. I know, for example, the two children that I have the privilege to care for, excuse me, with Susie, my partner, continue in their 30s and early 40s to seek our advice and our guidance and our support, and occasionally bank transfers in order to enable them to continue to succeed and achieve in their lives. Many care experienced young people do not have that. That underscores the importance of us taking a temperature check on how well we are or are not collectively supporting young people. So the Ofsted report is yet another reminder that we are still not getting this right. And the journey that I've sketched out that began for me when I was a social work student and when I qualified in 1978, that kind of journey and the concern that I have about the fact that we have not learned from history can be mirrored by the evolution of law and guidance in England for transitional safeguarding. I would be interested at the end of this presentation to know from those of you who are students of social work progressing through your qualifying course, how adequate you think the training that you have received on law has been. Because one of the things that we learn from safeguarding adult reviews and indeed from safeguarding children practice reviews is the lack of legal literacy across all services, but in this case in particular across children's social care and adult social care. So it's timely to remind ourselves of how law and guidance has evolved. And where there are powers and duties that the local authority in particular should comply with, such that it is therefore timely for safeguarding adult boards and safeguarding children partnerships to seek assurance about the levels of legal literacy and compliance with statutory duties. So here we go. So it starts, I hope not too arbitrarily, with the 1989 Children Act, the foundation of our legal rules, our current legal rules in relation to children and young people, and a provision in section 24 which still applies, that all young people who are care experienced qualify for advice and assistance from the local authority to promote their welfare when they cease to be looked after. That provision still applies. But as I foregrounded in my review of my early social work career before I became a social work academic in 1988, I profiled the work of Mike Steen, amongst others. And Mike was instrumental in contributing to what became the Children Leaving Care Act 2000. And what prompted Parliament to pass that Act in 2000 was indeed concern about what research was highlighting, and indeed what case law and ombudsman judgments were also highlighting in the failure of the state to adequately support young people navigating transition. So the Children Leaving Care Act aimed to strengthen section 24 of the 1989 Children Act by identifying groups of care experienced young people for whom the local authority would have enhanced responsibilities, enhanced duties to assess and meet their care and support needs, not least through the provision of a pathway plan and indeed the provision of an advisor. And the 2000 Act still applies and indeed has been updated, as you can see at the bottom of this slide, by regulations in relation to care leavers, and the regulations have the same force of law as the Act of Parliament itself. And then moving on, we have the Homelessness Act 2002, which also addressed the issue of transitional safeguarding as we now know it. It advised that young people should not be placed in bed and breakfast accommodation, but that still happens. And of course, there is the additional concern at the moment of care experienced young people being placed in unregulated settings, accommodation settings that fall outside of any kind of regulation, whether by Ofsted, the CQC, or any other body. So the Homelessness Act 2002 sought to build on the architecture for care experienced young people. It sought to build on the Children Leaving Care Act 2000. And indeed, it still applies. The 2004 Children Act also contributed by applying the provisions of cooperation to safeguard and promote young people's well-being, by applying that to young people aged 18 and 19 who were receiving or are receiving leaving care services. And then the 2008 Children and Young Persons Act, requiring local authorities to have sufficient accommodation for looked after children in their area, and for ensuring that care plans cover a whole range of health and social care needs often experienced by care experienced young people. And requiring that the independent reviewing officer should adhere to the time frame for reviews, and ensure that young people are adequately safeguarded in suitable accommodation. But what I know from case law and from safeguarding children practice reviews, their predecessor serious case reviews, and indeed from some safeguarding adult reviews, we know that the workloads of independent reviewing officers are often such that it is a real struggle for IROs to comply with the expectations laid out in Acts of Parliament and indeed in working together the statutory guidance for safeguarding and promoting the welfare of children and young people. And then continuing the journey, the 2014 Care Act and its core principle of well-being applies to young people transitioning into adult services. It applies to young adults, and the principle of well-being includes not just physical health, but also mental well-being. And in the Care Act 2014, the local authority has a duty, specifically in section 58, to conduct a transition assessment in relation to care experienced young people who are likely to have care and support needs after the age of 18. And I will share with you shortly in the presentation a safeguarding adult review, a thematic review that I completed for Havering Safeguarding Adult Board in East London. And one of the questions I asked practitioners and managers involved in transitional safeguarding in Havering was whether they were aware of the Section 58 duty, and whether they were aware of how that Section 58 duty had been amplified by other sections in the Care Act and indeed by the statutory guidance that accompanies the Care Act. And I have to say that the vast majority of practitioners and managers I asked that question of as part of the thematic review in Havering had not heard of Section 58, were not aware of Section 58, and were certainly not endeavouring to implement Section 58 of the Care Act and indeed the statutory guidance that elaborates on how that duty is meant to be performed. In other words, neither of the young people whose situations I was reviewing had a formal transition assessment. There are still yet more additional measures to support care leavers. There is a reference to care leavers in the Children and Social Work Act 2017, and this slide provides detail on those provisions. And then we have the Homelessness Reduction Act 2017 and its interface with the Housing Act 1996, which it builds upon. It does not replace. Again, seeking to strengthen the eligibility for assistance for young adults, young people and young adults, whether or not care experienced, who are homeless or who are threatened with homelessness within 56 days of a referral being made. And I know from my work as an independent chair of safeguarding adult boards and indeed my work as a SAR reviewer that just as we might be concerned about the lack of legal literacy, the lack of compliance with the legal rules that emanate from the 2014 Care Act, I also have some concerns that our housing colleagues and indeed our colleagues across health and social care are either not aware of the provisions of the Homelessness Reduction Act or are aware but are not applying them and implementing the provisions in the way that Parliament intended. So the law has evolved, but we are nonetheless left with the question that the legal provisions, if you like, the law in theory, is not what happens in practice. So again, particularly for those of you who are still students of social work, there is a difference between a distinction to be made, concerns to be expressed about the difference between the law in theory, which is what I have just run through, and the law in practice. And you may often encounter in practice placements now, but subsequently in your social work career, a disjunction between what the law requires and actually what actually happens in practice. And all of us have a leadership responsibility, irrespective of the positions that we hold, to highlight when local authorities and other partners are not compliant with the law in theory. And the evidence for that disjunction, that lack of alignment, if you like, between the law in theory and the law in practice comes from case law, as well as from local government social care ombudsman decisions. And indeed, for all of us, I think we have a lot to learn from routinely accessing case law and indeed from routinely accessing local government social care ombudsman decisions. And indeed, you can get weekly updates from the local government social care ombudsman about decisions that the ombudsman has reached, about complaints that have been made to the ombudsman, right across the spectrum of children's social care and adult social care. And they are interesting judgments to read. They're not all by any means critical. Sometimes local authorities have been exonerated by the local government social care ombudsman. But nonetheless, there is some useful learning to be had through accessing those decisions. So here, however, on this slide, I'm focusing on case law rather than on ombudsman decisions. And you can see as you skim down this particular slide, examples where local authorities have not complied with the legal rules in Acts of Parliament, in regulations, in statutory guidance, have not complied with the legal rules on assessment, or where the contents of plans for care experienced young people have been judged to be inadequate and outside of the legal rules, and where agencies have not cooperated with each other to provide wraparound care for care experienced young people navigating transition. There are, of course, case law judgments that have exonerated local authorities, that have found, as a result of scrutiny of the records and interviews with practitioners, that indeed a local authority has complied. So it isn't all bad news, as it were, but nonetheless, these case law decisions and are timely reminders to all of us to seek assurance that the law in theory is what is happening in practice. And there is a role for safeguarding adult boards there. There is a role for safeguarding children partnerships there in relation to seeking assurance, because that's the mandate that the partnerships and boards have, to seek assurance that the legal rules are being complied with, and to do that now rather than waiting for a safeguarding adult review or a coroner's regulation 28 notice or a safeguarding children practice review. And I've referenced safeguarding adult reviews, and If you look at safeguarding adult reviews, you will find frequently referred to shortcomings. And this slide identifies the most frequent findings in relation to transitional safeguarding, and much the same picture emerges from what we used to know as serious case reviews, what we now know as safeguarding children practice reviews. So we have shortcomings around poor planning, the absence of policies and procedures, or perhaps these days more often now, a lack of awareness of policies and procedures that actually exist, or awareness but a lack of implementation of the frameworks that those policies and procedures provide. There are shortcomings about the inadequacy of risk assessments, and indeed about shortcomings in guidance that would help social care and other practitioners to complete robust assessments of risk. We have shortcomings in relation to how children's social care and adult social care work together, and a failure to use multi-agency and multi-disciplinary meetings, case conferences, high-risk behaviour panels, whatever you call them, but an absence of convening the system, bringing everybody together to share information, to share risk assessments, to contribute to risk assessments, and to attempt to devise plans that might mitigate the risks that have been identified and enable wraparound care to be provided for care experienced young people navigating transition. We hear about the shortage of therapeutic pathways for young people and young adults who have experienced trauma, loss, adverse childhood experiences. We know about the impact of adverse childhood experiences. We know about the impact of trauma. We know about the impact of loss. We know that that impact can profoundly affect a person's mental well-being as well as their physical health. We know that there are connections between adverse experiences and the misuse of substances, for example. We know about the importance of addressing a person's lived experience, a person's backstory. And we know that these traumas and adverse experiences can live on well into adulthood. We know this, and yet we're still finding that there are unclear or inadequate pathways for responding therapeutically with care experienced people in order to address their lived experience. And I've already highlighted the lack of legal literacy, and I highlight specifically here, and in relation to children's services colleagues in particular, a lack of legal literacy about the Mental Capacity Act 2005, which applies to 16 and 17-year-olds as much as it applies to adults 18 plus. Having identified the shortcomings, it's important to correct the balance by noting that some safeguarding adult reviews do report good practice in terms of policies and procedures to support transition planning, and do identify good practice in relation to pathway planning and support for care experienced young people navigating transition. And indeed, some safeguarding adult boards, in response to the findings and the recommendations of safeguarding adult reviews, do report changes to practice and to the management of practice as a direct result of review activity. So for those of you who are board members, for those of you who are senior leaders, indeed for all of you in the room, you can take a temperature check and an appreciative inquiry What are the obstacles or the barriers? What are the shortcomings and the pinch points that you are aware of through your lived experience of work? And where are the good news stories? Where is the good practice happening that you might wish to promote? So there are good examples as well as shortcomings, and yet nonetheless concerns remain. And I'm now going to talk just about some cases with which I'm familiar, and indeed I'll reference briefly the case that Christine Cocker reviewed, the case of Madeline. But I'm going to start with the case of Ms. A. You can read the Safeguarding Adult Review on Ms. A. You will find it on the Havering Safeguarding Adult Board website. It's one of the first cases that I reviewed as a SAR author after I retired from full-time academic life. And you can see here that Ms. A took her own life. She jumped out of a window of her flat. What we don't know was whether she intended to take her own life. Or whether, in fact, she was endeavouring to escape from housing practitioners and police officers who were coming up the stairwell of the accommodation in which she had a flat with a boyfriend of hers, and whether she was concerned about what might happen when the housing practitioners and the police officers arrived, and she tried to escape from what she imagined or feared might happen. It's not clear whether she intended to end her own life, but she died of the injuries that she had sustained. She had been a looked after young child, a looked after young person for the early years of her life. She was in and out of local authority care, but was eventually made the subject of a care order, which lasted then until she reached the age of 18. She was well known to not just children's social care, but also mental health services, substance misuse services, and community safety services, as well as secondary healthcare providers. And there was evidence to concern that she fabricated and induced illness as a feature of the distress that she experienced as a result of, first of all, the abuse and neglect that she experienced, the periods when she was in and out of local authority care, and then subsequently the breakdown of a number of placements with either members of the extended family or indeed with foster parents and potentially adoptive parents. One feature of her case, which I've not put on the slide, but has remained with me as an indication of her lack of the absence of her mental well-being, is that Ms. A very often took on different personas, different personalities. She would sometimes, with paramedics or police officers who did not know her, she would give false identities and false addresses. And indeed, when she jumped out of the window, she left behind her boyfriend. And when the police interviewed the boyfriend, he did not know her real name. She had not disclosed her real name to him. She had not disclosed whole features of her lived experience. It was unknown to him. And I think that is, at least in part, an indication of the level of distress that she continued to carry, that she might have managed through, for example, fabricating and inducing illness, that she might have sought to manage by persuading substance misuse services that she was addicted to Class A drugs and needed methadone prescriptions. In fact, there is no evidence that she was addicted to Class A drugs, but nonetheless, she was able to secure supplies of methadone. I made some recommendations in that particular case, and to the credit of Havering Safeguarding Adult Board and indeed Children's Social Care, Adult Social Care, Children's Mental Health, Adult Mental Health, the way in which the local authority and its partners managed complex cases changed quite significantly as a result of the Mersey SAR. And indeed, care experienced young people and care experienced young adults were involved by the local authority in co-producing services for young people approaching transition and young adults who've navigated transition going forward. So it was possible for the local authority to point to change that had resulted from this particular review. And one of the changes that resulted was the formalisation of a transitions panel that was designed to review all cases of young people approaching transition and indeed the outcomes of transition planning for care experienced young people. And the importance of the panel being formalised was brought home to me and indeed to everyone involved in this review by a leaving care worker who herself had been care experienced and who was employed as a leaving care worker prior to her making decisions about whether she wished to train as a social worker or a youth worker or some other kind of practitioner within, if you like, the social justice architecture. And she was the person who knew Mersey best. And yet she was routinely excluded from conversations that were held about what do we do about Mersey. She was the least qualified in academic terms and professional terms. She was the least qualified person in Mersey's network of services, but she knew most about Mersey and was often excluded from conversations. I then had the opportunity to go back to Havering, and not an opportunity that I would have wished to happen, but Havering had two further referrals of young adults who had died as whilst going through the transition to adult services from children's services. Both of these young people were care experienced. The review has not been published in full for reasons to do with the sensitivity of the information available about the families in both cases, but there is a 7-minute briefing on the Havering Safeguarding Adult Board website that you can access and read. So here, child, adult, Q, well known to children's services and adult services, well known to mental health services, well known to substance misuse providers, somebody with suicidal ideation, and a young person with a history of adverse childhood experiences, who died as a result of a mixed drug overdose when he was living with his father, and his father's new family. Um, um, that wasn't always the case. Child adult Q moved around, experienced periods of homelessness, sometimes living with his father, sometimes living with his mother, sometimes being accommodated by the local authority. And then the other person whose situation was included in this thematic review found deceased in his accommodation in semi-independent living, into which he had only very recently moved. It was a matter of days. Again, who died as a result of a mixed drug overdose, but where on this occasion a verdict of suicide was reached by the coroner. Again, very well known across the architecture of services. Again, somebody with a long history of adverse childhood experiences, and rather like the case of Ms. A, concerns here about fabricated and induced illness. And indeed, he had been the focus of a serious case review when he was still a child, where fabricated and induced illness had been a central feature of the case. So what did I find when I went back to Havering? So what I found was that there was a commonality between the two cases around transitional safeguarding, around substance misuse, around mental health and mental distress, including use of the Mental Health Act 1983. In at least one of the cases, the young person had been sectioned under provisions of the 1983 Mental Health Act. That there had been a lack of use of adult safeguarding procedures in Section 42 of the Care Act, and that there were shortfalls in how health and social care had responded to the healthcare needs and the care and support needs of both of these young people. And there were concerns about the adequacy of mental capacity assessments, particularly when these two individuals were 16 and 17 years old. And although services tried to work together, the transitions panel wasn't used in either case, in fact. And although services did from time to time come together and shared information, there wasn't adequate risk planning and a review of the outcomes of the work that services were attempting to do with both of these individuals. And certainly in one of the cases, the Youth Offending Service described feeling abandoned by all of the other services who, for one reason or another, pulled out of supporting that particular individual. And when the Youth Offending Service came to the end of the order that they were supervising, essentially then the young person was left alone. And so what we found, and indeed this resonates with findings in other kinds of safeguarding adult reviews, we found that there was a tendency to review non-engagement as an individual being unwilling to engage. There was insufficient consideration of whether in fact the young person or young adult was not brought. But equally, there was a failure to consider whether, in fact, a young person or a young adult did not attend appointments because they were either unable to or indeed were victims of coercive and controlling behaviour, including by other family members. So there is a challenge to us all not to use glibly, oh, well, they don't engage, they're making lifestyle choices, but to think through who is not engaging here. Is it them or is it us? And if we conclude that, in fact, it's not us, how do we understand a person's lived experience that might result in them being unable to be where we expect them to be at defined points of time. The erratic nature of cooperation, collaboration, the use of multi-agency meetings, for those of you in Sussex and beyond who are familiar with safeguarding adult reviews, you will know that that is a frequent finding, that we are not convening the system, we are not bringing people together to contribute information, to share assessments, and to agree plans that might mitigate risk. We found that the care and support assessments that were done in both cases were not as robust as they might have been, and local authorities were not considering whether, in addition to whether or not a person had eligible needs as defined by the Care Act, whether in fact a power to meet any care and support need should have been activated. So for those of you who do care and support assessments, don't just think Section 9, don't just think Section 13 and the list of eligible needs that you might have a duty to meet, but also look at Section 19, where there is a power to meet any care and support need. The concerns about mental capacity I've already flagged. The concerns about the adequacy of transition I flagged when I highlighted that there was very limited awareness of transitions assessments as required by the 2014 Care Act. And there were concerns about how substance misuse services and mental health services worked together, both in relation to children and young people, but also in relation to young adults. So again, as you take an appreciative inquiry or a temperature check about your lived experience of work in Sussex and elsewhere, are we still seeing the revolving door syndrome? We can't deal with the mental health until we deal with substance misuse, or vice versa. Are we still seeing too many examples of where it's either or, when in fact it should be both and? So I made 18 recommendations designed to build on the achievements in Havering, and it's important to point out that there were achievements in Havering as a result of the MAS-A review, but nonetheless further work to do, including how cases got to the transitions panel, people's awareness of the existence of the panel and the importance of making referrals to the panel as soon as the transition planning process began, any time from the age of 14 onwards. Recommendations to audit practice routinely in order to provide assurance for the Safeguarding Children Partnership and the Safeguarding Adult Board that practice was as good as it could be. Recommendations to escalate concerns about the shortage of placements, particularly specialist placements that could meet the complex needs and the challenging behaviours of both of these young people. And you can see the other recommendations, summary of the recommendations that I made. And again, that may or may not resonate with or remind you of your lived experience of work in Sussex and or elsewhere. And then I want to pay particular attention just for a moment or two to the case that Christine Cocker with Fiona Bateman reviewed. You can find this Safeguarding Adult Review published on the Croydon Safeguarding Adult Board website. It was Croydon Safeguarding Adult Board that took responsibility for reviewing the Madeline's situation. because it was in Croydon where Madeline died, although Madeline was actually the responsibility of a different London borough when she was a looked after young person. You can see here that she was living in an unregulated placement, and there are moves at the moment to fill that gap about unregulated placements with a bill currently attempting to go through Parliament. She had a considerable history, as did Ms A, as did the other two young people whose cases I was talking about a moment or two ago. She had a considerable history with child and adolescent mental health services, including as an inpatient as a result of her adverse experiences, but also as a result of a diagnosis of being on the autistic spectrum and other diagnoses relating to her mental health. She had a number of placements, as you can see there, including in secure accommodation. And you can see that just before she turned 18, she moved from secure accommodation to supported living in Croydon. And you can see that the London Borough responsible for her as a care experienced young person is noted there alongside the London Borough in which she died. And the findings, again, very similar to the findings in Havering and similar, I have to say, to other findings from other safeguarding adult reviews that have looked at transition, was that we did not make safeguarding, adult safeguarding personal. For Madeline, we didn't listen to her. We didn't really try to get alongside what her lived experience had been, and that we did not involve her sufficiently in care planning. Planning was done about her, not with her. That support for her mental health was fragmented, and that there was a lack of whole system engagement in relation to supporting her through mental distress, as well as a lack of whole system engagement in order to meet her complex and challenging needs, in addition to her mental distress. That risk identification and multi-agency management was very poor. Again, very similar to the findings both in the Mosaic case and my subsequent thematic review in Havering. And again, a lack of legal literacy to support transition and indeed to support young people with diagnoses on the autistic spectrum. That may, again, resonate with some of your lived experience, or you may think, well, we're doing better, perhaps in Sussex or elsewhere than happened in this particular case across 2 London boroughs. So how can we build on the learning from safeguarding adult reviews? It's important to point out that there are quality markers published by Sky, recently updated and republished by Sky, that provides advice for safeguarding adult boards and indeed for SAR authors to be clear about where their knowledge comes from, what knowledge they are drawing on, what evidence base they are using, and more about the evidence base for transitional safeguarding in a moment or two. It's important to refer to the first and so far only national analysis of safeguarding adult reviews, the reference for which is in the references at the end. and to point out that that national analysis of which I was a part was critical of SAR authors for not identifying explicitly the evidence that they are drawing on when interpreting findings and indeed reaching conclusions and making recommendations. And indeed, we made recommendations in the national analysis for the development of an evidence base for best practice across all types of abuse or neglect and across all types of situations that adult safeguarding comes into contact with, of which transitional safeguarding is clearly one. And why? Why should we do this? Because otherwise we are going to repeat learning. We are going to start again. And for those of you who are on the children's side of the architecture, you will know that a common complaint about child protection and working with children in need is that practitioners start again. They do not build on the history of a case, but they start afresh. And we are in danger of doing that with safeguarding adult reviews, unless we really think about, well, what do we already know? What have we already learned? Have we applied that learning in our particular localities? And how do we build in our localities on the learning that has been secured either locally or regionally or indeed nationally? And equally, it's my view that whether you are doing a safeguarding children practice review, a domestic homicide review, a mental health homicide review, or a safeguarding adult review, that not only is it important to understand local practice, the local context, it is equally important to zoom out and to look at the legal policy and financial context within which child protection and adult safeguarding is located. We know about the impact of financial austerity, particularly but not just on statutory services. And there may well be gaps in the legal rules and gaps in social policy that safeguarding adult reviews highlight. And it's important to call out the national system when we find that there are shortcomings that are national rather than local. And that is part and parcel of us attempting to answer the question why. And I began this presentation by saying in 1978, this was my experience. When I became a social work academic in 1988, this was my experience, particularly in relation to levels of legal literacy and for the purposes of this afternoon, what we knew about transitional safeguarding, even if we didn't call it that at that time. We need to continue to ask the questions why. And it's important, and when doing that, not just to accept our current organisational structures as unchallengeable and as fixed. If we think that a different system is what we need, then we should be arguing for that. There is a very interesting book which I can recommend by Hilary Cottam called Radical Help. It focuses more on health and our NHS than it does on social care, although it does focus to a degree on children and adult social care. But what it argues is that the current system that we enjoy, for want of a better word, across health and social care was created in 1948. We are now in 2023. And we have to ask ourselves questions, serious questions, which are political, which are social, as well as being local. Serious questions about whether a system that began in 1948 and has been developed and has evolved over time since, remains applicable in 2023, or whether we actually need fundamental structural and systemic change to create a system which is fit for purpose in 2023 and beyond. Before I conclude, then, I'm going to flip, if you like, and rather than focus on the shortfalls, the shortcomings, the concerns that I've done my best to articulate, I'm going to articulate what we can learn from that in terms of the evidence base for direct practice, the evidence base for how teams around the person support the person, and how well organisations support practitioners engaged in this complex and often challenging work. And it's here in particular that I'd encourage all of you to conduct your own appreciative inquiry and your own temperature check. How close do the services of which you are a part, how close to the services that you know about how close do they get to the evidence base? And if you get close, if your judgment is that there is alignment between practice and the evidence base, what has enabled that? And if there are obstacles or barriers that are preventing, either consistently or at least sometimes, preventing operational managers, senior leaders and practitioners getting close to the evidence base, why is that? And what can Safeguarding Children partnerships and Safeguarding Adult boards do to tackle the obstacles and the barriers? So what is the evidence base against which we can judge practice and service provision? So in terms of direct practice, we know that all of the research, all of the voices of people with lived experience, and all of the Safeguarding Adult reviews and Safeguarding Children practice reviews highlight the importance of relationship-based practice, highlighting the importance of co-production with young people and young adults, highlighting the importance of making safeguarding personal, of personalisation, and that within that there is a profound understanding of the person's backstory, their lived experience, and the strengths that they have, the resilience that they have, but also the challenges that they experience. And if you like, that is captured in the question, what has happened to you? That we know that practice is developmental. We know that the age of 18 is an artificial determination. We know, not least from the work of Christine Cocker, Des Holmes in Research in Practice and elsewhere, we know that the brain continues to develop well beyond the age of 18, and that our practice should therefore recognise or rather be developmental rather than artificially bound by different age determinations. And we know about the importance of practice recognising and attempting to respond to trauma. We know about the importance of recognising and attempting to build on the strengths that young people and young adults have. And we know about the importance of offering persistently wraparound integrated support for young people and young adults. We know, therefore, about working with the whole person, that what we see in front of us is not just a healthcare need or a care and support need or a mental health need or an accommodation need. What we have in front of us is a person. And we need to respond to the person, not just to that little bit of the person that falls within our immediate remit as a service provider. We know about the importance of recognising protected characteristics as defined by the Equality Act 2010, of having an appreciation of what a person experiences by way of gender, sexuality, race, disability, religion, age, and recognising the importance of challenging ourselves in relation to the stereotypes, the unconscious bias, the assumptions that we might bring to this work and indeed to other work, and recognising that we should make reasonable adjustments in order to respond to what are protected characteristics in law. Equally, we need to recognise the impact of coercive and controlling behaviour and undue influence. And as part of that, we should challenge any assumptions that we and others might hold about lifestyle choice. And we know that we need a much more profound understanding of the Mental Capacity Act, the 5 principles in the Mental Capacity Act. And by way of passing, if you ever encounter somebody who says the individual has a right to make unwise decisions, refer them to Principle 3 in the Mental Capacity Act, because that's not what the Act says. And ensure that all assessments fulfil the statutory requirements and indeed are timely. We know about the importance of planning, that the evidence base requires that planning is robust and not just what I might call plan A's, but also plan B's. What will you do if plan A, your preferred plan, preferably co-produced with a young person, does not materialise for whatever reason? What will you do then? And the importance of seeing this as a transition, not a discharge. If there is one word that I would scrap, or one of many words that I would scrap from the English language, particularly in relation to how we talk about things in social work and indeed in healthcare, I would scrap the word discharge. We are not discharging somebody from somewhere or something. We are endeavouring to support somebody to transition into a new setting, a new part of their lives. And I know that for myself. I retired from full-time academic life in 2016. I went through a transition. I wasn't discharged from work. I transitioned from full-time academic work into the next phase of my life, to think about transition and what would we want for transitions that we are ourselves experiencing, and can we take that understanding into putting ourselves in the position of people that we are working with and for. And then if I move beyond direct practice with individuals, and I move outwards a little to the team around the person, the voices of lived experience, safeguarding reviews, and indeed research, identify very clearly the evidence base. The evidence base is that we should work together, that we should collaborate, that we should co-produce, that we should come together in multi-agency meetings to share information and to coordinate planning, that we should be aware of all of the legal rules and the contribution that they have to make, and particularly of one legal rule here, namely the Data Protection Act 2018, which is not a barrier to sharing information without consent where necessary in order to safeguard a child or an adult at risk. And then if I move outwards still further from the team around the person to organisational support. And here I would ask a question that I would invite you to reflect on and maybe to comment on when I stop speaking in a few moments. and that is who looks after you. Whether you are a student social worker, a student for a different profession, somebody newly qualified in their first year of practice, or a more experienced practitioner, operational manager, or senior leader, who looks after you? Because you are dealing with complex work, complex situations, challenging situations, where very often the right thing to do is not immediately obvious. Who looks after you? Who enables you to reflect, to debrief, to plan, to manage your lived experience of work? Because we cannot expect you to be the best practitioner or manager that you can be if you are not looked after. So what is the quality of supervision? What is the quality of support that you receive from your own organisation and from colleagues elsewhere? And do you have available to you specialist advice from lawyers, from mental health, from mental capacity specialists, from substance misuse specialists? Do you have available to you specialist advice and guidance that you can acquire when you need it, not when you've got permission to seek it? And do you have sufficient opportunities for continuing professional development, which is why World Social Work Week is such an important initiative, and why it's so good that Sharon and colleagues in Sussex have put on a whole week of events to contribute to your professional development. And do our organisations, individually and collectively, work with young people and young adults who have experienced transitional safeguarding to co-produce services and practice that might more effectively meet their needs? And that involves commissioners. It involves commissioners talking with providers about where there might be gaps in services, and it involves commissioners escalating concerns where there are gaps in provision, which it is not proving possible or easy for commissioners to resolve locally or regionally. And it requires senior leaders to give permission for the evidence base to be the flag around which we coalesce, that this is what we are aspiring to do, this is our ambition, and senior leaders providing their support and their endorsement for an evidence-based approach to, in this case, transitional safeguarding, and ensuring that there are policies and procedures, protocols, frameworks that provide a context for operational managers and practitioners. And within all of that, that caseloads are manageable. And I go back to my comment earlier about independent reviewing officers, and I well remember one particular judgment, one particular case law decision, which was roundly critical of, in fact, Lancashire County Council for not safeguarding the workload of an independent reviewing officer who was responsible for 120 cases. Just think about it for a moment. One member of staff responsible for reviewing the 120 cases of young people being looked after by the local authority. Unsurprisingly, the IRO could not manage that, and the human rights and the care and support needs and the protection and safeguarding needs of young people were neglected as a result. And then lastly, the responsibility of safeguarding adult boards alongside community safety partnerships and children's safeguarding partnerships to ensure a system-wide coordinated response to transitional safeguarding, and to conduct not just reviews but also regular audits to provide assurance that services are getting close to the evidence base for best practice. And as I've said, calling out the national context where we think the national context is creating barriers or obstacles that are frustrating our best efforts locally. And a final word, this time from another very recent publication by the Department for Levelling Up and Communities, otherwise known as DLUC, because in their publication, Ending Rough Sleeping for Good, there was a recognition, as I flagged right early on in this presentation, that care experienced young people are at risk of experiencing homelessness or insecure accommodation. And so the rough sleeping strategy from DLUC includes an acknowledgement of that and a requirement that safeguarding adult boards and partner agencies should implement the recommendations from this particular report. So in the end, this is about human stories. It's about people's lived experience. It is about how we support people to navigate through experiences, whether adverse or otherwise. And it's about all of us reflecting on whether we have the best system possible for supporting care experienced young people to navigate and to survive and move on from transition. And if we don't, we all have a leadership responsibility locally, and I would argue nationally, to do what we can to ensure that the human stories that we witness subsequently are more positive than many of the human stories that we have witnessed hitherto. Here are some references, and if any of you are not able to obtain any of the references that are mentioned here, then I will endeavour with my academic hat on to provide them. Thank you for listening, and I hope in the time that remains available we can have a conversation about your lived experience of work and any questions that you might have of what I have presented. And I'm delighted to